So this is a case report from Johns Hopkins that involves a 70-year-old male with a history of CLL, common variable immunodeficiency, and hypothyroidism, who presented with severe arm pain and weakness following a herpes zoster infection. He described the pain as burning, numbing, stabbing, and tingling, and was localized to the left arm, specifically in the ulnar distribution. But the unusual aspect of this case was the significant weakness alongside the pain, which is a symptom not typically associated with postherpetic neuralgia. So this case is notable for the rare development of brachial plexitis alongside postherpetic neuralgia, which is a combination that's rarely been reported in literature. So he was initially managed with gabapentin and amitriptyline, but this provided limited pain relief. Despite the lack of significant improvement with the stellate ganglion block, further investigations were prompted because of the atypical presentation of the weakness. So an EMG was done, and that suggested an axon loss in C8 and T1 innervated muscles, which was highly indicative of brachial plexitis. But a definitive diagnosis was challenging because the patient's pain intolerance to a complete EMG study and his inability to conduct a brachial plexus MRI. So with the conventional treatments proving inadequate, the decision was made to proceed with a pulsed radiofrequency ablation targeting the C8 dorsal root ganglion. And this procedure actually resulted in significant pain reduction, which demonstrates the efficacy of targeted neuromodulation in cases where typical interventions fail. So this case really serves to underscore the importance of recognizing atypical presentations of postherpetic complications and adapting treatment strategies accordingly. And I also think it highlights the need for further research into the mechanisms and management of brachial plexitis in the context of postherpetic neuralgia, emphasizing the contribution of these rare presentations to broader medical knowledge and literature. So this discussion aims to bring attention to the rarity of brachial plexitis as a complication of herpes zoster, advocating for awareness amongst clinicians to improve diagnostic accuracy and patient outcomes in similar cases.